Hi everyone. You can understand it's loud enough? Yeah. Hi, my name is Leo. I'm staffer from TrIQ in Berlin, Germany, and I did put everything I want to say in the script, which makes me more nervous than if I hadn't had this script. So no wonder if I search a line or get totally lost, and I try to get more flexible throughout the presentation. Um, I'm part of the group of activists from several European countries who are part of the Queer Healthcare Project that have worked together for 2 years from Hungary, Cyprus, um, Croatia, Norway, Sweden, and Germany, who are also here with us. And Trans Interqueer is the German organization taking part in this project. We are a social center in Berlin, established in 2006, and provide psychosocial counseling, peer-to-peer counseling, and social counseling for trans and inter and queer people, and are one of the about 6 organizations in Berlin funded by the Anti-Discrimination Office of Berlin State. So there is psychosocial counseling possible in Berlin for trans people almost on a daily basis, which is crucial for the support, I guess, and which is a real benefit. So my talk to you, my input would be about trans health activities and counseling in Berlin, and hopefully it gives also some ideas about how to support with no funding or with only a very bit of funding. Let me show you some of these organizations who provide this counseling in Berlin, which is the Gay Counseling Center and 2 others. So now you can hear that 2 are printed more in the Trans Interqueer, and another one they were, well, it doesn't, isn't, it, yeah, the Queer Leben. These are the ones who are specified on trans people and inter people. So the others would cover trans issues among other target groups. Um, One is specified on the needs of trans people of color, black trans persons, and migrant trans persons, which is the Lesbian Counseling Center, though they are welcoming both trans female and trans male clients. And a few other organizations work for trans people, but not on counseling, but on education or on assisted living. In practice, this variety of organizations means that trans people, once they know about these organizations, can make their choice what kind of trans health-related counseling they like, with the additional benefit that it takes place in a safe environment. So we have psychosocial counseling, peer-to-peer counseling, and anti-discrimination counseling in a broad extent in several organizations, and it's provided by trans and inter or queer, lesbian, gay counselors, which makes all these places hopefully kind of safe spaces for trans people and far safer than an environment that is focused on medical care or that is more like state-run would ever provide. Yesterday we've been to the gender clinic, and I've learned that the system here, how to get legal gender recognition and gender reassignment surgeries, is centralized, which is totally different in Germany. I'd like to quickly show you how it works over there. Maybe I don't. No, I don't. Should I? Don't I? No. No, I won't show you. So it's it's different. It's totally decentralized. So and I would shortly tell you how it works to see how important like competent trans experts themselves giving counseling are in this setting. So to get your legal gender recognition, you have to meet two experts, mostly psychologists, therapists, who the court would give to you. So you have to meet them, and often they would like put their own gender ideas on you, just you asking for your legal gender recognition, like please show me your belt, show me your purse, and let's check if this fits to your gender you want your legal gender recognition for. On the medical talking about the medical transition, you need 18 months of mandatory therapy. After 6 months, you would get the health insurance allowance for hormone therapy, and after additional 12 months, the allowance for gender reassignment surgeries. So this is crucial, these 18 months, to get some therapist who would be trans aware, respectful, non-humiliating, non-pathologizing. So trans people coming to these organizations I've shown you would ask lots of questions in this kind of safe environment, like which therapist to choose for your mandatory therapy, the impacts of hormone therapy, how does the trans-related health system works, which surgeons are there, which health insurance is more or less restrictive or supportive, where to find a trans-friendly dentist or endocrinologist, where to find a fitness studio engaged in support of trans women regarding dress rooms or trans or gender or non-gendered, or non-binary persons, or where to go for trans-only sports and other activity groups. Thanks to this infrastructure, given right at the trans spots, the trans person experiences, hopefully, we hope, empowerment and acceptance, and this much more than at a non-trans environment in which the trans person would need to educate the counselors first, which happens far often. So this shows that, this makes that the counselors in these organizations are pretty thankful for about like 1,500 counselings. I think if we put all these organizations together, we provide every year for trans people, and we appreciate very much trans people coming to these sessions to tell us as trans ourselves counselors their stories. So the counseling is, in a way, highly professional, but on the other way, still low threshold. So. And also regarding the Q&A this afternoon on suicidality in the Swedish presentation about the survey, of course the psychosocial counseling would also answer these questions and give psychological help on questions around suicidal thoughts, suicidal attempts, but with a counselor who's trans themselves and have maybe share some of the experiences the client would tell. There is one, let me see if I can show you this. Surprise, yes. There is one paper that has been done by the Berlin State. These are kind of quality standards for the counseling for LGBTI persons, and they give some ideas about what's important among the trans counselors, which is, for example, empowerment, also a big awareness about structural discrimination. Especially regarding what we have already heard about, that there is only very few intersectional aspects sometimes involved in trans counseling, and another brochure would be that gives some standards. It's about intersectional counseling for trans and inter people, provided by Trans Interqueer 2 years ago. This brochure emphasizes the fact that it is necessary for counselors to have a proper knowledge and understanding of intersections and multiple discrimination, and especially once it comes to trans people of color, black trans people, homeless trans people, migrant trans people, those who experience discrimination on more than the ground of just gender identity, but also on other grounds. Now, besides this counseling structure itself, I'd like to present 2 networking structures. So for these networks, you don't need any money. You just have to be inviting to colleagues, and sometimes this morning someone said sleep with the enemy. I think it was Maria. So find the enemy, and but the understanding is not about enemy, but the understanding is about alliance. So first, it's the quality circle. Let me see. Is there something about the quality circle? Yes. Um, it's an interdisciplinary network about that was founded in 2010, and there trans counselors come together with therapists, endocrinologists, other healthcare providers, health insurances, and meet on a monthly basis. And all of them are working with trans clients and patients. So now we have heard about WPATH, WPATH, and ePath. So this could be something like BPath, just for Berlin. Um, and what makes it very attractive for therapists is that it is certified by the Chamber of Psychotherapists. So this is some benefit therapists get out of it when participating. Um, in this network, let me give me a second, please. In this network, therapists would meet trans counselors and get their ideas about what needs do trans clients have, what sorrows do they express in the counseling sessions, and it's kind of let's say place to exchange about trans issues and get the medical stuff people are depending on track, and keep them informed about discrimination, about how to make it better in support of trans people. Another there should be another like about 38 dots, but it's only 2 dots. So let me see. Then we have the Trans Counselors Network. This is more an informal network, which is where all the trans counselors of these 10 organizations come together. So there are about 9 organizations working on LGBTI issues going there, and another one is working for people who have faced sexual violence and were female assigned at birth. So this organization has opened themselves also for trans people, trans men and trans women. So we would come together once a month and exchange what's going on, discuss cases. And it's something very useful and very easily to establish in a way. So this July we have our first proper month of event, where the whole month of July we will have events around trans healthcare, like workshops on HIV prevention, or on body perception, on sports. So this network also gives kind of guidance to each other, to the counselors, but also to the trans community itself. This could be about sport. It could also be about something else. But then that's interesting. It could be, huh? I don't know, but anyway. It's nice. So let me talk a bit about sports activities that they are. So they were very free. They have been established just by volunteers. So there is, let's say, weekly kung fu for trans people at the trans interqueer spot. So people would do martial arts and perceive their body in a different way, and feel more assured to leave their homes and and feel stable against violent attacks on the streets. Just by doing martial arts in a trans safe space. There would be a group of trans people with impairments. At the moment, especially trans people with learning impairments, who meet regularly and exchange their experiences in a very restrictive health system. At the moment, there are many workshops around body perception of trans people. So there will be workshops around body perception of trans sex workers, because we have just got the funding for a project on trans and sex work, which is not covered at all at the moment. So trans sex workers wouldn't come to our organizations, to none of these you've seen a while ago, and ask for support or share their experiences. So with this new project and body perception workshops for trans sex workers, we hope to get access. And we will also provide a survey among trans sex workers. And this survey is done right on the streets, in the working environment. And the people we have asked to do the survey and who are interested to run this project are a trans female sex worker and a trans male sex worker. So we hope to be close to the target group, and to also improve trans healthcare access for sex workers. Something that is missing in a way until now is a good taking care for around the issue of safer sex. Soonish there will be published the first trans safer sex brochure in German language. It says tasty and safe safer sex for trans people and their sex partners, which will be published soon. So until now there is only material in English language, but this is going to be published out of this queer healthcare project we are here with. And soonish there will be the question of trans and HIV. So we have done the first workshops for outreach workers who go in the gay community, which is huge in Berlin. So these outreach workers would do safer sex work there, but most of them are not trans identified and have no clue what would happen. How could they support useful some trans person at their safer sex work? So we give workshops for them to give them some useful material how to provide also safer sex counseling on the spot right in the community. There hasn't been yet until last autumn a network for trans persons with HIV. So this is another topic. There is much work needs to do. But last autumn, the first time ever, I think there were 4 trans people with HIV came together from all over Germany, and soonish around this Trans Inter July provided by this counselors network, there will be workshops on trans and HIV, where hopefully also trans people with HIV will meet again in the Berlin context. So although the Berlin community is pretty large with this issue as well as with safer sex, people would be like very how you say zurückhaltend. I ask other German speakers zurückhaltend, holding back with coming out as trans persons with HIV or in sex work. Still, these activities, I think they were crucial also for kind of a community experience. So people would come back to the psychosocial counseling and tell their stories, and there they would tell their needs also, and be trustful that that's another environment, because the trans counselors are trans themselves and maybe can far easier recommend which sport activities are there, which group activities are there to go. So besides that, there have been missing about like 10 slides. I hope this was kind of an overview about how also with just bits of money or even for free there could be offered some activities, and I'm happy for any questions.
Thank you for a very interesting presentation, and congratulations of all the very good work that you're doing in Berlin. My question concerns the quality circle that you have set up, which is a very interesting project, I think, that might be followed on in other countries as well, or other cities. So my question is, how did you succeed in organizing this, and even having this system of that the therapists get points for their certified points or something that you mentioned, because that would probably be kind of a huge stimulator for them to be there at the quality circle. So this is really interesting. Like, is it like done in cooperation with the city council, or how did it come about?
Lucky us, there are a few like psychologists and therapists who are trans themselves within the Berlin community, who also recommend for the renewal of the guidelines, which are expected to come out within the next few years. So, and it would be a cooperation with the chamber. I don't know if it's chamber for psychotherapists, who of course face the, let's say, also the increasing number, I think, of trans people in need of therapeutical assistance because of this mandatory therapy that everyone is requested to undergo to get their gender reassignment hormone therapy and surgeries. So it's like knock the door. So and then it's established around the Center of Sexual Sciences, where in the center itself, therapists would work closely with many trans persons. Not that these therapists wouldn't be free of critique or also like but this alliance has established this circle, which which is really of good use for trans clients and patients, because there you don't have this power relationship that the client needs to complain right at their therapist, but you have another therapist who's maybe trans, or social worker who's trans involved, who would communicate these things. So if there is any chance in your local contexts and this isn't existing yet, I could imagine this as very, very useful.
Thank you. How I understand what you have, like all the different parts that you have been describing, that this is very much grassroots based, even if like then as you describe also that there are then counselors that are also trans identified, then being sort of professionals but still part of the community. And I'm wondering how all this work, and if then if it is also connected to a more how do you say, like political lobbying for change within the system, political system, or the social system as it works, or if this is mainly focused on providing care in different way to the community, as in like down to the sort of grassroots, rather than lobbying, or if there is an aspect of that as well.
So talking about trans and queer, I really appreciate with this about this organization that it enables both. Some activists would go to the hospital where inappropriate treatment of trans persons would happen and discuss with the medical staff and work more on this lobbying level, while others would, like, I don't know, do a kiss in front of the door or throw tomatoes or whatever. But everything is possible under the same roof. But and on a more general level, there are attempts since a few years to renew the transsexual law, which is kind of abusive, that people have to go to court. So they have this to consult these two experts who mostly are therapists themselves. So to change this law, there are strong attempts made by a variety of trans organizations all over the country, though many of them don't have funding at all and are much more focused on self-support and also in very rural areas. So in talking about Berlin, the trans community itself is so fragmented that it's not easy to focus on the one goal, like let's renew the transsexual law. So now at the moment, the trans activists all over the country try to start a nationwide organization, which is difficult because usually in countries where they have started with a nationwide organization, like I think in Ireland there were first was the TENI, and then more and more groups started, and the other way around. It might be complicated much more, but we tried to establish this autumn to get more like access to let's say to this also national politicians, so who better like to talk to one nationwide organization than to this local organization and this self-support and this grassroots organization. Yeah, but it's not only focused on psychosocial counseling but also on like improving especially the TSG transsexual law.
Thank you.
If there are no more questions, if there are, it's wonderful. If not, we could go to royal wedding or whatever you, Carolina, plans to do. Okay, thank you.
Thank you all so much for participating and speaking and everything that you've been doing, and giving your good questions and your remarks. Thank you very much. And I will later put all the clips from the live streaming will be available on YouTube. And also we will put it on the project's blog. We have a blog for the Queer Healthcare Program that we will put if someone wants to watch this magnificent conference afterwards again. And also I will put up some presentations, if it is okay with all the presenters, I will put them on the blog. And also I've got the permission from Micah to put here thesis on the blog. So even if Micah couldn't be here, we can still read the thesis. So hopefully you will have a really sunny night, and yeah, take care and a lot of love to you all.
Just before we all go, I just wanted to just acknowledge Carolina's work and also Caro within RFSL for organising this conference day today and bringing the different organisations and the different experiences into the same room in Stockholm. So thank you very much indeed, Carolina, and also to acknowledge the live streaming team in the back there, leaving the video for being here today, and also then providing the opportunity for people all around the world that aren't here today in Stockholm to see it online. So thank you very much indeed to them as well too.